Hello everyone, I'm Dr. Bowen. I'm a board-certified physiatrist here at New Jersey Regenerative Institute, or NJRI. Recently I posted a video on the 8 most common knee problems we see here at NJRI, and another video with more details on osteoarthritis. Since you all loved the last video so much, we decided to make another video more in depth about the second most common knee problem we see in the office, which are meniscal tears. I hope you like this video, and if you do, don't forget to like, subscribe, hit that bell notification, and leave a comment letting us know what other videos or information you'd be interested in. Alright, let's get into it. The second most common knee problem we treat are knee meniscal tears. The menisci are C-shaped shock absorbers between the thigh bone or femur and the lower leg bone or tibia. There are two types of tears that happen in this area. First is an acute traumatic tear from a specific event. The second is more general degenerative wearing and tearing that occurs over time, and the pain comes without any specific incident inducing it. How would you know you have a meniscal tear? Well, the first type of tear, the traumatic, can feel like there's a sudden pop or have acute pain. This usually comes from an abrupt stop, twist, or turn motion. With both types, there can be pain, clicking, and a feeling that the joint just gets stuck. Additionally, you may experience swelling or stiffness, and this can cause the knee to give way. If your symptoms don't resolve within some time and you seek medical care, you'll be asked about your symptoms and have a physical examination performed. Here at NJRI, we do an exam of the entire leg to view you holistically. Sometimes you need additional screening with MRI or X-ray. There are lots of treatment options for meniscal tears. If you watched the last video, you'll probably recognize most of them, as many of the treatments are similar. Physical treatments can include things like ice and electrical stimulation to reduce swelling in the knee. To help maintain strength, the buildup of this fluid inhibits the quadricep muscle, or the muscle in the thigh, from working. A physician will likely tell you to temporarily modify your activities and avoid things that cause pain. They may also prescribe a course of physical therapy to address your biomechanical impairments. Often a trial of non-steroidal anti-inflammatory medications are recommended. Some physicians will even perform a steroid injection. But here at NJRI, we try to stay away from these because there's limited evidence for long-term benefit. I also can recommend a trial of acupuncture for patients. Now, let's talk about surgical fixes. There are various surgeries with the goal to save the meniscus. Since 2005, there's been a large increase in the performance of meniscal repair surgeries. However, these surgeries are still not the best way to fix the meniscal tears, and are often only done in patients under 40 years of age who are very active. Meniscectomy is actually taking a portion of that C-shaped shock absorber cushion that's inside the knee that's torn or unstable and is causing mechanical symptoms. Unfortunately, this causes increased load and wear and tear on the articular cartilage from where that meniscus used to be, and this leads to acceleration of the cartilage damage or arthritis. There's been a reduced rate of these meniscectomies for degenerative tears in older population, since the research has demonstrated that lack of benefit that's no better than conservative care. This leaves people seeking for alternatives. Here at NJRI, we want to provide you with alternatives if conservative care is not good enough for you or didn't get you to the functional level that you want, and also if you want to avoid surgical interventions. Our regenerative procedures can include things like platelet-rich plasma or PRP injections, as well as MFAT procedures. Usually I see more success with MFAT procedures though. MFAT stands for microfractured adipose tissue. Essentially, this is a fluid that we create after we extract your fat and we process it in the office. The process is fairly quick and done in the office in the same day. Since the field of regenerative medicine, or orthobiologics, is new, and there are many questions, we started a database to collect outcomes from these procedures, and they'll help determine the optimal treatments for you and other patients. That's why we figured out that MFAT is better for meniscal tears than PRP. Our database is called Data Biologics, and the growing data will help inform our future decisions. So not only the treatment here is helping you, but it's also helping future patients who will benefit from the data we collect from your treatment. Now, if any of these options seem confusing, stay tuned for upcoming videos explaining more on what these procedures are, what the science is behind them. In the next few weeks, I'll be doing a more in-depth explanation of PRPs and MFAT procedures, the science behind them, and what the procedure actually looks like. I hope you enjoyed this video and you now have a better understanding of meniscal tears. If you think you have a meniscal tear and you're struggling with it, please find a healthcare provider to help you. If not, I'd be privileged to see you in the office, so please give us a call so I can help you get back to full function. Whatever you choose, I hope that this video informed you, and all of us here at NJRI wish you good health. If you like this video, take a minute to hit that like button, subscribe, and feel free to leave a comment below telling us what you learned, what you want to hear more about for our future videos. You can also follow us on other social media outlets such as TikTok, Facebook, Instagram, and X, all of which are linked in our bio and pinned in the comments below. Thanks for tuning in, and see you soon.